3 centimeter or 2 centimeter, we can do the aspiration and suck off the fluid. And not every time we should do the cytological examination. For those patients, for the recurrence cyst or the sharply increased cyst, we should do the cystologic analysis. And for some patients, if there are some suspicious or if we think maybe it's a malignant disease, we should do the dissection. Because there is a special kind of breast cancer named intracystic breast cancer. Sometimes look like a cyst, but a part of the cyst is occupation by a lesion. Next, move to the breast abscess. There's two kinds of breast abscess. The first kind is more. The first kind is lactational infection. When a woman is in the lactational period, sometimes the milk will stay in the breast, and then inflammation, and then becomes a breast abscess. It's so normal, yeah. And another subtype is chronic subareolar infections, usually associated with duct ectasia. I have many patients. Some patients even not married, but she will suffer from the abscess, but usually the chronic abscess. Because the duct ectasia, or because the inversion of the nipple. So let us say about the lactational infection. The etiology is the lactation of the milk, and then the bacteria break into the duct. And the clinical in the future is just inflammation. We can see the erythema, swelling, fever, and tender. And she will feel general discomfort. For example, chill, fever, leukocytosis. Yes. And how to prevent it? So we should empty out the milk. If the child cannot suck all of the milk, we should empty out the milk. And then pay attention to clean the nipple and avoid biting of the child. The child usually like to bite in the nipple, so this time you should avoid the damage. And then the result of the breast abscess, if you use the antibiopsy quickly, and the inflammation will sometimes be disappeared, or sometimes become more severe. Just like this one, like these people, we can see there is a soft area. Soft area is needed to drainage, and the most severe case will develop to sepsis. Okay, treatment, antibiotics, and the severe cases, you should use the drainage. The last one of the ANDI, fibroadenoma. Fibroadenoma is more popular in the young women. Usually the teenage girls and the women during their early reproductive years. And the etiology is not clear, and also is because of the estrogen, the stimulation of the estrogen. So for the breast disease, the main causes is not only the malignant disease, the benign disease is also estrogen. Yeah, and it like to happen in the upper external conduit. Sometimes solitary and sometimes multiple, and easy to recurrence. The feature of the fibroadenoma is a painless mass. You can just feel it, but no pain. And most of them solitary. To treat the fibroadenoma, we can use the cone needle biopsy, and we can do the excision. I think there is some two kinds of the fibroadenoma. One kind is so stable. For such kind of fibroadenoma, we just do the biopsy, is okay, and then follow up. We can keep the mass in the breast. There's no harm to the body. But to another type, like the germ fibroadenoma or germinal fibroadenoma, it will be developed very soon and become larger and larger. So for this kind of adenoma, we should do the operation. Let us see the mammography and ultrasonography of the breast fibroadenoma. Just now, in the BI-RAD system, I have called if there is just a cause calcification, we call it category 2. Why? Because this popcorn-like calcification is a specific sign of the fibroadenoma. So if you see this picture, don't be afraid. It's just adenoma. This is ultrasonography film. We can see the characteristics. It's ovary shape. Shape is ovary and well circumscribed with a thin capsule, and the quality is same. And we see the ratio of the deeps to the length is less than 1. So it's a benign lesion. And after the operation, we can see the pathologic sign. It's homogeneous and capsulated. Then we move to another part. It is breast cancer. There I show you a picture. This patient is a famous movie star in China. Just one patient. This is the film picture. The film is lead-munching gene of lead-munching. Have you heard this? Yes. It's and the character is Lin Daiyu in this film. Yeah, Lin Daiyu. So she is so famous, and she was dead 2 years ago, 3 years ago. Yes, 3 years ago. Why died? Breast cancer. And she was so afraid of this disease and denied any therapy. Just to cut her hair, to go to the mountain, sleep her in a small. Denied operation, denied chemotherapy. Why? afraid of this. I don't know, because she is so believe in Buddhism. Yeah, she think maybe the Buddhism will protect her, so deny any treatment.
What was her age?
Yeah.
What was her age?
Yeah, age 14, just less than 15. Yeah, less than 15 years old. 50, sorry. Okay, the breast cancer was more likely to happen in the 30 to 60 years old, this area. And just now I have seen in the China, the most popular population is among the 14 to 15 period. And there's in European or in the America, maybe the above the 50s, yes. And the etiology, the first place is the estrogen. Sometimes I will say that the God is fair. The God is fair. Why? Because if our woman have more estrogen than other women, she will look so beautiful with white skin, elastic skin. Yes, so it looks more beautiful. But it was the function of estrogen. The estrogen have take her the beauty, but also take her the damage. Sometimes she will suffer from the breast cancer. So God is there. And another reason is the hereditary. In the breast cancer patient, we can find there is two genes related to the breast cancer. One is BRCA1 and another is BRCA2. This kind of two genes are related to the breast cancer. So if the patient have these genes, we should, if a normal patient have these genes, we should pay more attention to her, and it was high risk population. And sometimes, if our patient is suffer from the breast cancer and also have such kind of genes, some doctor will give her resection of another breast. The one breast is suffer from the breast cancer, and then cut all the breasts, two breasts. Diet. The breast cancer is have some relationship with estrogen. So if the diet have some relationship with estrogen, we should avoid it. So which kind of diet? And is some diet contain too much fat, because the fat will change in the body, yeah, step by step into the estrogen. So we should pay attention to the diet. And also there's so many Chinese traditional, not drug, just some drugs to help the body stronger. Yeah, sometimes we like to eat the secretion from the bee.
Honey.
Yeah, honey. Yeah, from the queen of the bee. Yeah, honey. It was not good for breast. For some patient has the breast cancer genes. not good for such kind of pace because we think there's some B estrogen inside it. Yes, and also the swollen. Oh, I cannot say so. Sorry, a bird to do swallow. Yeah. The home of the swallow. Not this swallow. Sparrow, yes. Sparrow.
Okay, let's see, a bird then.
Yeah, a bird. There's a home. The house. Nest. Yes, the nest of the swallow. Sometimes we think it's so useful for the women. Yeah, so useful for the women because, but for such kind of high risk population, it's forbidden.
The nest of the sparrow. Yes, how long?
It's also because of estrogen. Yes, also because of estrogen. So if the population has such kind of risk factor, don't use such kind of material. Nest.
Excuse me, Raushan.
Nest, not house.
Yeah, what like when they will eat it like or what do you do?
Chinese medicine. Can you say nest of?
It's not kind of medicine, just some material to strong your body, especially for women.
It's like traditional Chinese medicine.
Not Chinese medicine. It's not included in the medicine category.
So how do you eat it?
Yeah, we can eat it. You bought it from the store and then put the nest into the water. Yeah, and light it maybe several hours later. Next, and other causes may be the menstruation. If the patient has so early menstruation or so later menopause, it's a sign of one sign of this. And some doctors think pregnancy and lactation will help person to avoid breast cancer. And then let's see the classification of primary breast cancer. Okay, next move to the classification of the primary breast cancer. There's two kinds of breast cancer. First one is the non-invasive breast cancer. Non-invasive. It means the breast cancer is limited in the duct or in the lobe. For this picture, we can see the transverse section of the duct. And if the breast cancer is just along here, fill in the cavity, not break the basement membrane, we call it non-invasive breast cancer or duct carcinoma in situ. And another group of the breast cancer is invasive cancers. In the last two classes, I showed you a lot of pictures of breast cancer, the ultrasonography, mammography. Most of them are this group, invasive breast cancer. It includes invasive lobular carcinoma and invasive duct carcinoma. The invasive ductal carcinoma is the most popular group in this in this classification. And maybe the none of specific type is take up 50% to 70%. And of course, there is some specific type of carcinoma. For example, tubular carcinoma, mucinous or colloidal carcinoma, or invasive papillary carcinoma, and so on. But this is rare. And next, we will say the metastatic pathways of the breast cancer. Now we are learning more and more cancers, in every organs of the breast of our body. The metastasis pathway of the breast cancer is not so special. It's just like other organs. The first way is the direct invasion. Direct invasion. That's a picture. Oh, this is not a man, a woman. Yeah, because the breast is so great. So when it happened, there is a mass happened. It was so easy to invade into the skin and also invade into the muscle. It's the direct spreading. And the next approach way is lymph metastasis. Let us review the 4 ways of the lymph metastasis. The first way is to the external side, to the axillary areas, and to subclavicular lymph node and to supraclavicular lymph node. It's the main lymph node exchange way and also the main lymph node metastasis way. And the second way, can you, to the another side, to internal lymph node, and the third way to the another side of the breast, the fourth way to the liver. Besides the direct invasion and invasion and lymph metastasis, the breast metastasis is usually happen in the breast cancer. The surface organs will be liver or bone or lung, and sometimes to the brain. It's rare. Sometimes to the brain. There, I write down occur earlier these words. It means the breast metastasis is so easy to happen. So easy to happen. Even the lump is so small, or maybe less than 1 centimeter or so. You can find some small mass in the lung or in the liver. So it means in our treatment place, we should not just emphasize on the local therapy, and the systemic therapy is more useful, more important. And the clinical feature of breast cancer is just as below. If the breast cancer is in the early stage, we just can feel a painless mass, or there's no mass. There's no mass can palpate. Just from the mammography screening, if there is a microcalcification, and do biopsy, we find the breast cancer. And if the breast cancer in advanced stage, the size will be changed, become larger and larger, and we can find some specific signs which I have introduced to you. For example, deeply or orange-like sign. And there's sometimes the mass will be unmovable, and sometimes the mass will be ruptured if in the later stage. And sometimes there's some satellite lesions around the chest wall. Of course, if the breast cancer is metastasis to another organs, we can have relatively metastatic symptoms. This is more heavy dimple. And this is the rupture of the mass. This is the satellite lesions. This is I don't like to see these films. This patient was suffered from breast cancer and do the operations and the chemotherapy and the radiotherapy, and but she is estrogen negative, so don't have the endocrine therapy. But the lesion was occurred soon, and just like armor-like. The treatment is all over the treatment. Every kind of method is used. And there's the arm becomes swollen. It's so difficult for her. And of course, she lived not long. It's past. I will introduce you two kind of specific type of breast cancer. One is inflammatory carcinoma and another is Paget disease. They are couple, but extremely different couple. Why? The first one like hot, very hot, and the next one is ice, just like ice. Why? We can see the characteristics of this kind of two carcinoma. For the inflammatory carcinoma, we can see the pictures before. It will happen usually in the pregnant stage or lactation stage. And the appearance is just like the inflammation. It was erythema and swollen, and there's the orange-like sign. And then it progressed very quickly, and the operation or the chemotherapy is not so effective. And then it has a poor prognosis. So I think it's just like a light or very hot. This picture shows the inflammatory carcinoma here in the left breast, very rare. And the next Paget is Paget disease. It usually happen in the old patient, and they're involved the big lactiferous duct. So the lesion is just near the nipple. The nipple will have some chronic eczematite changes. So usually she go to another department to check the skin, and maybe after the biopsy, the doctor will send her to our department because it was a carcinoma of the breast. And this kind of disease is progressed so slowly and have a well prognosis. And this is the picture of the involved nipple. We call it Paget disease. Usually the Paget disease is an intraductal carcinoma. And then we should staging the breast cancer. It's international station of the breast cancer. I think we cannot remember all the data there, but we just have a look. For the 0 stage, it means the carcinoma is in situ, carcinoma in situ. And for the first stage, it was referred to the carcinoma has a mass less than 2 centimeter. Has a mass less than 2 centimeters and has no lymph node metastasis. And then the second stage, if the mass is larger than 2 centimeter and less than 5 centimeter is in this stage, or if the mass is smaller than 2 centimeter.